I wanted to let folks know about another important opportunity that will be building on this webinar today. Health Resources in Action was fortunate enough to get a CDC conference grant, and we will be offering to our New England colleagues a training series called The Promise and Practice of Health Impact Assessments in Worcester, Massachusetts on May 31st. This opportunity is being co-sponsored by the New England Coalition for Health Promotion and Disease Prevention, Clark University, U.S. Department of Health and Human Services, Region 1, the Northeast States for Community Air Use Management, the New England Alliance for Public Health Workforce Development at the University of New England, the Northeast Biomass Coalition at UMass Lowell, and the U.S. EPA Region 1 is serving as one of our advisors. This is an incredible opportunity for people to learn really more about the practical application of HIA. And what we encourage you to do is to learn more about this by going to the following link, www.tinyurl.com/HIA series. We do have an application process for participating in this training series because we would like to get representatives across the 6 New England states. The deadline will be next week, so we encourage you to take advantage of this now. We will have more information about this at the end of the seminar. And so now it's my pleasure to be able to introduce our speaker, Dr. Lindsay Rosenfeld. Dr. Rosenfeld is a social epidemiologist with research interests in program and policy design that focus on the health impacts of non-health policies and programs, particularly concerning urban planning and design, housing, neighborhoods, education, and immigration. She's currently a research scientist with a team focused on child equity at the Institute on Child, Youth, and Family Policy at Brandeis University's Heller School for Social Policy and Management, my alma mater. She's also an adjunct assistant professor at Northeastern University's Institute on Urban Health Research. Throughout her career, she's served in numerous research policy, teaching, and community social service capacities, passionate about translating research into policy. Dr. Rosenfeld has varied experiences with health impact assessments, including participating in 2 Massachusetts HIAs, concerning the Massachusetts Rental Voucher Program and the Low-Income Housing Energy Assistance Program. And most recently, she served as a reviewer on the newly released National Research Council report, Improving Health in the United States, the Role of Health Impact Assessments. Dr. Rosenfeld earned her master's and doctorate degrees at Harvard School of Public Health. And so now I'd like to turn this over to Dr. Lindsay Rosenfeld.
Hello, good morning. I'm very happy to be here with all of you to talk about health impact assessment. This webinar will be a 101, so we will bridge a lot of topics, and we will follow up with some resources where you can get more information in addition to my contact information, in addition to the conference that's coming up. So I look forward to spending a little time with you talking about health impact assessment and some of the promise of HIA in the United States, sort of where we have to go and where we've been. One second, please. All right, we got it. It's advancing now. So again, this is a Health Impact Assessment 101. We're going to have an introduction to the practice. And I look forward to receiving your questions throughout, and we will address as many as we can at the end of the session. So let's first just, let me give you a sense of what we'll be covering today. So we're going to talk about what HIA is. We'll get into the link between HIA and the social determinants of health, with a particular focus today on planning and development and its relationship between social determinants of health. We'll talk about the HIA process. We'll look at an example of a Massachusetts HIA. We'll talk about why would we perform an HIA, what are the benefits, what are the challenges, and then how do you use an HIA once it's been performed. So first, let's start off with the basics. What is HIA? So the Gothenburg Consensus Statement came out in 1999, and it is sort of the standard definition for health impact assessment worldwide. So that really talks about HIA being a collection of procedures and tools by which projects, policies, and programs can be evaluated based on their potential effects on the health of the population, and also really looking in a public health sense at the distribution of those effects within the population. Now recently we've had a lot of movement in HIA across the United States, and at the fore of that is the Health Impact Project. And the Health Impact Project talks to us about HIA in this way. They say to stem the rising tide of chronic disease and create safe, thriving communities, health needs to be regularly factored into policy and program decisions in sectors that do not traditionally focus on health outcomes. And this is really the crux of HIA. It allows us to prospectively, prior to implementing a policy or a program or a project, to understand what information we have about the health impacts of that issue. And it really uses a variety of data, as we'll get into, and a variety of stakeholders and researchers and information. So many people talk about HIA as a method or a tool. And what is the point of it? The point is to evaluate the possible impact of major policies or projects on health. We're looking at social, economic, environmental policies, programs, and projects, and the effects across those domains as well. It's also a method or a tool that allows us to estimate effects of a specific action on the health of a defined population. So it's saying what effects can we estimate, and being very realistic about what effects we can't estimate as well. It is allowing us to assess potential health impacts, both positive and negative. It also allows us to increase partnerships and communication between both public health professionals, planners, other decision makers. Whoever is a stakeholder at the table really allows us to increase and foster these partnerships and communication across sectors. It also allows us to improve the quality of public policy decision making. So we've made recommendations perhaps from an HIA that really are going to enhance our predicted positive health impacts and minimize negative ones prior to implementing a policy or a project or a program, so that we really can have a sense in some, spelled out methodological way of what we think might happen. So this map is to give us a sense, and I've got two, to give us a sense of where HIAs have been completed in the United States. And this map is a little bit older. It comes from work at the CDC, and we sort of see, a spread across the country, but certainly more in some regions than others. And in 2009, they had counted about 54, and that number is much, much higher now, as demonstrated by the Pew map. And the Pew map is coming from the Health Impact Project, which I talked about earlier, which is one of our national programs to really increase training on health impact assessment, increase connections and networking across health impact assessment. So the blue dots represent where HIAs have been done. The yellowish orange dots represent Health Impact Project funded HIAs. So we see that we've gotten quite a boost by this Health Impact Project and what we've been able to accomplish and across the country where it's happened. And the red dots show where multiple HIAs have been. And there was a conference last week, which was the inaugural Health Impact Assessment Conference in the United States, which was very exciting advancement that we are now having sort of a national discussion about HIA. And my understanding from that conference, which unfortunately I wasn't able to attend, is that this map is growing even more, and we'll have an update hopefully on their website soon about that. So as we move forward, I want to talk a little bit, give a little bit of a context about the link between social determinants of health, HIA, and planning and development. Now, of course, there are many other areas that we could talk about related to HIA and social determinants of health, but for today's purpose as an example, we're going to focus on planning and development. So first, let's just get a definition of social determinants of health. What is social determinants of health? So this is a perspective or a lens that asks us to consider how social factors impact health. So that could be things like gender, social class, race, geography, etc. And I want to sort of delve a little deeper into one example of how social determinants of health ask us to really look at what those determinants are. So for example, if we focus on issues of race. So in a social determinants of health framework, racial justice doesn't equal diversity. Diversity is variety, right? So a phrase that's often used is, it's not enough to mix it up, you got to fix it up. So just to create diversity is not really getting at the aim of racial justice or considering race in a social determinants of health perspective. Likewise, racial justice doesn't equal equality. Equality is sameness. So the purpose is not to get everything the same. The purpose is for equity. So racial justice would equal equity. And you could go through this sort of thinking with gender, with geography, with sexual orientation as well. So really thinking about within that framework how we're considering these social factors and at what sort of level or degree we're considering these social factors. So this is a framework that's often shown that really helps us understand not only all of the issues that may be involved in social determinants of health, which is a central piece of health impact assessment, but also that social determinants of health is really something that's considered across levels. So at the sort of middle here, we have issues like age and gender, or sort of constitutional factors that then are sort of encompassed in and impacted by individual lifestyle factors, which is again couched within social and community networks, which is again couched within issues like education, living and work conditions, housing, which is then again couched within general socioeconomic, cultural, and environmental conditions. So it's really taking the perspective that at each one of these levels, the determinants are important, and how they interact and influence each other across levels is very important as well. So when we talk about planning and public health nowadays, we're starting to see this sort of resurgence of a discussion where they're connected and interlinked. And that is really historical as well. Even though there was sort of 100 years where people weren't considering these things together, it really, these fields developed out of the need to work with one another. So things like sanitation, crowding, rapid urbanization, all needed architects and planners to figure out how we were going to space our streets and plan our buildings, and then we really needed public health professionals to think about, well, how does disease get transferred, how does it not get transferred, you know, how do the spaces and places in which we live affect our health. So there was this sort of link and togetherness, you know, in the early 19th century as these fields evolved, and they sort of went apart and were sort of coming back together. And this is very important in thinking about health impact assessment as well, because it really is about getting all these stakeholders in different sectors to come together, work together, and understand where there are connections and links. So I also just wanted to highlight some recent examples of this, books, articles, and sort of active projects that are bringing together these issues of planning and public health. And this is a very short list. It's just giving us a sense, but it does show that there is this resurgence, and this is all recent work. So we have a text out by Ruff Lopez that looks at the built environment and public health. We have a book that's about designing healthy communities. And then we have articles that are really looking at this joint urban planning and public health framework and looking at built environment and human activity patterns. So places that are doing this quite a bit, and again, this is just a few examples. The San Francisco Department of Public Health has an HIA sort of group, and it's one of the few that does, where really they do HIA on a routine basis and incorporate a broad sector, or excuse me, broad sectors of people into their HIA work. Philadelphia has the Food Trust, which has really looked at food environment and food access and food policy, and really trying to understand some innovative ways of changing the food environment through zoning, through financial incentives, et cetera. And then here in Massachusetts, Amherst has really moved forward, and they're not the only ones to do this, but there still haven't been that many. The comprehensive planning process is something that needs to happen all the time. Every planning department in any sort of city or town or whatever does this process. And Amherst is saying, we're going to do a healthy master plan. We're going to take health into account at every step of this comprehensive planning process. So this is another example of how we are moving together, planning and public health moving together, and really taking this social determinants of health perspective. And we see this across academic work and practice work too. So there's this acknowledged disconnect between the fields. For example, Jason Corburn, who writes a lot about planning and public health, is saying that urban planning practice shows few signs of returning to one of its original missions of addressing health. And on the other hand, the CDC, the Centers for Disease Control and Prevention, is saying, well, there really are strong links between the field. We know that heart disease and diabetes and obesity and asthma and depression are diseases that can be affected by how we design and how we build our human environment. So there's this interesting tension, coming together, not, et cetera, but there's a lot of talk around it, which is very exciting. And really looking at HIA is one of the ways to both in practice bring sectors together, but also have a process by which we really can use the information that we have to help us make better decisions. So one example of this work or data that's useful in an HIA is a very famous study by Michael Marmot. And he and his colleagues looked at health inequalities within countries, and they took the U.S. for an example. And they said if you catch the metro train in downtown DC to the suburbs in Maryland, the life expectancy changes from 57 years in downtown at the beginning of the journey versus 77 years at the end of the journey. So this means that there's a 20-year life expectancy gap in the nation's capital, just along that metro line. And this is predominantly between the poor and African-American people who are living downtown and the richer and predominantly non-African-American people who live in the suburbs. So obviously this is an issue of place, this is an issue of race, etc. And these are the kinds of things that we need to take into account, both with the social determinants of health perspective, but also with HIA, and it allows us to do that. So the challenge, Jackson and Kochitsky talked about this about a decade ago now. They said the challenge facing those with responsibility for assuring the health and quality of life of Americans is clear. We must integrate our concepts of public health issues with urban planning issues. So this includes urban planners, engineers, architects, and others who need to see that they have a critical role in public health, and likewise that public health professionals have to appreciate the built environment and how it influences public health just as much as vaccines or water quality or other issues that quote-unquote traditional public health might deal with. Now, this isn't to say that this is easy. You know, talking across sectors presents all kinds of exciting opportunities, and it presents a lot of challenges. So this is a short list again, but in my work, you know, you've seen, and I was very conscious when we were talking about that quote and that information from the CDC to say Centers for Disease Control. Because from the planning perspective, you say CDC, and we usually mean community development corporations. Right, so it takes some learning of jargon and of acronyms and this kind of thing to be talking fruitfully across sectors. But there's some work on this and some resources. NACHO, the National Association for County and City Health Officials, has created some glossaries. So they've done a very nice one, public health terms for planners and planning terms for public health professionals, sort of help get us on the same page. And then they've also created a document, Public Health and Land Use Planning and Community Design. And they've also created this flow chart for built environment, urban planning, and public health working together. What are the steps? How can it connect? You know, how might this all work? Now, this isn't to say that you read these documents and you're set to go, but it certainly helps build a common language as you move forward to sitting across the table from each other. So in terms of HIA, social determinants of health, this is a list that certainly if we were all together in a room we could expand on, but it just gives us a sense of what kind of issues are we looking at. We're looking at everything from education, housing, community and economic development, environmental policy and programs, architecture, city design, international development, housing issues, transportation, neighborhoods, racism, racial residential segregation. These are all things that are within the purview of social determinants of health, specifically within the planning and development purview, and issues that would be considered in an HIA. Now, this also can seem like a very overwhelming list. We will talk about when we get to HIA as a method, how you deal with the quantity of data and the quantity of information in everybody's interest. You know, how do you put a cap on this? And that often depends on how much time you have to do an HIA, all issues which we'll get into. But this sort of forms the context for us about what is it that we consider in an HIA. So then on the other side, or sort of the health piece, we're considering, when we look at all of those social determinants of health issues, we're considering everything from physical activity, obesity, air quality, water quality, food quality, injuries, accessibility, social capital, access, social equity, mental health, noise. These are all health considerations that we need to take into account or think about how we address or don't address and why within a health impact assessment. So this is another sort of formal tenet from Europe when they created the Adelaide Statement about health in all policies, which is a statement that basically says, like HIA says, we need to include health in all our policies. We need to consider health impact in every policy that we put forward. And so they are linking in this statement that relationship between health and all policies and HIA, such that a fundamental tenet of health and all policies is that it is possible to predict the health consequences of policies. Health impact assessment could be a tool that helps policymakers foresee how different options will affect health and then choosing between those options. And again, it's a method to lay out this information. And so we have also the support of health and all policies as we move forward in thinking about how is it that we would use health impact assessment. So just as a precursor, in case you're not as familiar with Health in All Policies, and there's a link to the document there, but Health in All Policies addresses the effects on health across all policies. It seeks to improve health and at the same time contribute to the well-being and the wealth of nations by very particularly looking at structures, mechanisms, and actions both planned and managed, namely by sectors other than health. And then it also, importantly, is not confined to the health sector and to the public health community. So that statement before about seeking to improve health is really emphasizing this complementary strategy and looking at this very high potential towards improving a population's health when you have this complementary strategy. Because, specifically, you're looking at health determinants as the bridge between policies and health outcomes. So one example of the social determinants of health perspective linked with the health impact assessment perspective could be used in meeting action plan goals. So again, we're going to get into this when we talk more specifically about the method, but it's to think about the goals that we have to meet, the programs or the projects or the policies that will be put in place to meet those goals, and how it is that we can take a social determinants of health perspective or do something like a health impact assessment. So in public health, we have these plans that are set out to, for example, reduce racial and ethnic health disparities, or there's a national prevention strategy, or we have Healthy People 2020. We have many plans like this that help us set goals about issues that we want to cover and goals that we want to meet. So how is it that we take a social determinants of health perspective with such goal and action planning? So I've just selected one as an example from the HHS Health and Human Services Action Plan to reduce racial and ethnic health disparities. And the goal there being to develop, implement, and evaluate culturally and linguistically appropriate evidence-based initiatives to prevent and reduce obesity in racial and ethnic minorities. So that's one of the goals within this action plan. So the sort of quote-unquote usual public health lens would be to do something like try and provide more nutrition services, access to regular medical care, create a medical home, cooking classes, grocery shopping trips, exercise programs, exercise groups. These are all excellent things. The social determinants of health perspective does not tell us to get rid of these things, but what it asks us to do is open and broaden the strategy, both by working with other sectors and thinking sort of outside the usual public health lens. So a social determinants of health perspective, which is related to the issues that you would cover and try to address in a health impact assessment, would be to add to that. So let's say we took a built environment and urban planning lens, since that's our focus and our example for this webinar. We would want to do things like think about walkable streets and neighborhoods, think about access to transportation for clinic visits. We'd want to think about places to buy healthy, affordable food, think about the sidewalks or the environments to walk in, creating walking paths that have destinations, designing welcoming, safe sidewalks and crosswalks, bike paths, thinking about rules of the road, thinking about a bike share program, thinking about the advertising in our communities, thinking about racial residential segregation. So these are ways all to address that goal, which is develop, implement, and evaluate culturally and linguistically appropriate evidence-based initiatives that are going to prevent and reduce obesity. But it's thinking outside the box, quote unquote. It's using that social determinants of health lens, which health impact assessment is a very nice vehicle for doing as well. So partners could include CDCs, community development corporations, multi-service organizations, city departments, et cetera, as well as maybe a more traditional public health entity like the Public Health Commission or the clinic in the community. So bringing together all those sectors so there's really a broad perspective and a broad lens that's used to accomplish those public health goals. So now I'd really like to transition for the second half of our discussion into, we have all this context, we're thinking about, well, why would HIA be helpful? You know, how do we do the social determinants of health lens? And so HIA is not the only way, but it's one very interesting and promising way to bring together partnerships, bring together different sectors, and have a process by which you examine the evidence that's available. So the process for HIA is the following. And sometimes you'll see each of these steps named slightly differently, but generally they're the same thing. So the first thing that we do is screening. And we want to identify projects or policy for which HIA is useful. We want to see, is this issue, is this policy or project appropriate to do an HIA? Not everything is appropriate for HIA. So we certainly don't want to go beyond this first step unless we have decided that it is. And we'll want to identify whether we're going to do a desktop or a comprehensive HIA. And that really just means how much time do we have? Is the policy going to be up for a vote in the legislature in 3 weeks? And therefore we have 2.5 weeks to put something together so that we get a statement or a fact sheet or a little executive summary that can go out to the legislative staff? Or is this something that we know comes up, for example, in the legislature every year? So we have 6 months out to work on it. Or perhaps there's something that's in the planning stage in our neighborhood about a new crosswalk or a new park or something like that, and we have a little bit more time. So that's where you make the determination of how much time do I have, and then everything flows from there in the sense that you can cover different amounts of information and create different partnerships or collect new data depending on the amount of time you have. And the second step is scoping. So once you've decided that an HIA is what you're wanting to do, then you're going to identify which health impacts you're going to look at. So we had that slide of a long list of health impacts, and perhaps there isn't time to look at all of that. So perhaps you do a sort of cursory search of the literature and you decide that these are the top 5 health impacts you want to discuss. And you're very upfront about the fact that you can't discuss everything and these are the 5 you'll discuss. After that, you get into assessment, often called risk assessment. So you really want to identify how many and which people are going to be affected, and you want to assess how they may be affected. And we'll get into more detail about this step of the process. This is where we're really reviewing the literature, we're talking to stakeholders, we're conducting interviews, etc. And then from all this information, you want to create recommendations. You really want to identify changes to promote health or mitigate harm. So based on the research and the information you've pulled together and the stakeholders that are with you, you really want to think about what would we change? Would we say, yes, this policy should go forward as is? Should we say, yes, this policy should go forward, but we would make the following recommendations? Or, no, we think this policy is in no way useful. It creates all of these problems. We need to go back to the drawing board. In the 5th section is where we report. So we decide how it is that we're going to get this information out to colleagues, decision makers, whoever's sort of at the helm of making this project or policy or program happen. And we'll talk a little bit more about that in detail, and that can be a full HIA report, but then also something very digestible, a 1 to 2 pager that you can walk around the State House with, or you can walk around advocacy organizations or what have you with. In this 6th step, you're doing monitoring and evaluation. And honestly, this happens less often than we would like. It's a step that takes often extra resources, often something that's funded to do the HIA, and perhaps we haven't budgeted for this step, but more and more we're trying to make it part of what happens. It's essential to understand, did it pass? Did the policy go forward? Did the program go forward? And what really happened? Did something not happen that we were expecting to happen because we talked about it? Did we miss something entirely? Did we completely misjudge something? So this is where we really try to evaluate moving forward the impact of health impact assessment on the decision process and on the outcome. So let's get a little bit more in depth. So that first step was screening, where we say, is the HIA likely to succeed and add value? We're going to ask a variety of questions, things like what specific proposed project will the HIA address? If the HIA will address a proposal for a coal-fired power plant, for example, what specific decision-making process does the HIA inform? Is it about an air quality permit? Is it about an environmental impact statement? Or where in the line can we insert this information? How important to health is the decision? Will the HIA provide new and important information or insight on previously unrecognized health issues? Is it feasible in the terms of time and available resources? That can be data, that can be money, that can be political will, right? We really need to spend our sort of dollars and time wisely, and so those are things that we need to consider in this step of the process. The step 2, scoping, is really where we create objectives for our HIA, and we outline steps of the HIA process. So this is where we've said, yes, we're going to move forward, but now we really need to understand how we can move forward and what we can do in the time frame. So we're going to ask questions like, what health effects should the HIA address specifically? What concerns have stakeholders expressed about this pending decision, about a policy or a program or an upcoming project? And we want to really think about who will be affected by the policy or project and how, and make sure that if those people are not at the table or if those organizations are not yet at the table, that we get them at the table. And so in the risk assessment process, we're really looking at 2 things. We want to describe the baseline health of people and groups, and we want to predict potential health effects. So what's really important here in the baseline health analysis is to explain not only the important causes of illness, but also the conditions that influence health and could be affected by the decision in question. So is it the local economy? Is it the air quality? Is it the availability of parks and recreation facilities? Is it access to healthy food choices? You know, what is the issue that's at heart there? And what kinds of information do we use to produce the information that we're going to include in the health impact assessment? So the assessment stage can involve a literature review. It often does. It can involve qualitative analysis. It can involve quantitative modeling. And this is really about the resources at hand. This is about who's involved in the project. This will help you understand if you want to get, you know, a researcher from the local university organization involved to help perhaps model something that hasn't been looked at before. And in some HAs, you decide, you know what, we really don't have the space and the resources to model something new. We have to use the data that's been published, the interviews that we've done, you know, the survey that we've conducted, and that's fine. And the important piece here is not only to make those decisions, but to describe why those decisions have been made and to be very transparent about where the data and the information come from. So it's identifying the important health risks and benefits, but it's also this distribution. And HIA is really meant to be conducted in an impartial scientific way that identifies the risks and the benefits. So in HIA that just says everything about this policy is beneficial has really not done its job. You're really needing to weigh either what you think is a benefit, what you think is a risk, or what you don't know because we don't have the information to tell us that it's a risk or a benefit. And by laying that all out on the table is clear how you will come to your recommendations, which is the fourth stage. So the HIA is really pointing a way to decisions that protect and promote health. So for example, you could integrate an HIA's analysis and recommendations into a decision-making process with local legislatures or with, you know, the House of Representatives, wherever the policy may be. HIA can be done on the town, city, state, federal level. You may provide a thorough analysis that outlines the potential risks, benefits, and costs of alternatives to help policymakers make informed choices, because we always know the question is, how much money is this going to save us, right? Will doing this cost us more money or less money? And that's a very tricky question when we're talking about prevention and public health, because you can't always put a dollar amount on something that you averted, right? That's something that didn't end up happening. So that's no different in this process. It's not as though it's easier in this process. But what health impact assessment really helps us do is to lay out all that information that we do know and that we do have, and if possible, put a dollar amount on certain pieces of it if that's what's required. We're also looking at developing specific recommendations that come from the analysis, as I said, to be very transparent about what we do and we don't know and where our recommendations are coming from. Are our recommendations based on some qualitative interviews we've done with stakeholders? Very important. Or is it coming from a randomized control trial, which is seen to be one of the, you know, highest standards in science? Both are valid, both are equally important in a health impact assessment, but they provide different types of information, and so it's important to be transparent about where the information comes from. And then also something that could come out of an HIA in the recommendation process is creating some kind of product that provides practical, specific actions that can be taken in order to promote health and avoid or mitigate adverse consequences. So not just a recommendation that the policy should move forward or not, but providing some very specific actions around what could make it perhaps better for health impact. In the fifth stage of reporting, the point here is really to disseminate findings. It's often to decision makers, and that could mean policy or legislative decision makers. That can also be someone who's at the helm of an organization who's putting forward a new program. And really getting it out as well to affected communities and other stakeholders, and if there's time, to get some feedback. And hopefully those people are already around the table, so by the time you're putting out your recommendations or you're reporting on what the HIA found, you already have this input and impact. So that it's also important to take into account that the success of an HIA depends on effective dissemination, right? So that's like most things. If we're sitting around a room and discussing these issues, that's great, but if we can't get it out there so that decision makers and community organizers and community organizations can use the information and perhaps take it up and also bring it to their legislators and be advocates, you know, it doesn't do us much good. So really one of the tenets or practices in HIA is to conduct HIA with an eye toward the policy levers, the legal or regulatory avenues, communications and non-lobbying advocacy tactics, or other methods that are really going to make sure that there's effective dissemination of the findings and facilitate adoption of the recommendations. So part of the HIA process is making sure those stakeholders around the table who think that this information is important, but also making sure that there are stakeholders around the table who are committed to getting that information out there when it's done. That really each one of these steps is as important as the next. So implementation of HIA in this, that hopefully comes from reporting would be applying recommendations. They could be under existing laws or policies, or that we could create new policies or regulations, and really also doing media outreach, which can help you engage, educate, and build consensus. And then this last step about monitoring and evaluation, which I said unfortunately doesn't happen as often as we'd like, is really an essential. It's the sixth step. It is part of the of the HIA process. So 3 types of evaluation could happen. We could do process evaluation, which is really gauging the HIA's quality according to some kind of established standard and what the original plan for the HIA was. We could also do impact evaluation, which is assessing the HIA's impact on decision making and its success according to objectives that were established during scoping. Or we could look at outcome evaluation, which is assessing changes in health status and health determinants as this decision is implemented, right? So that's monitoring indicators that can be used to inform process, impact, and outcome evaluation. So ideally, all 3 of these evaluation types would happen, but it's hard to think about a scenario in which that would happen. So perhaps you pick one, perhaps you pick a piece of it to really understand what impact the HIA had and where it helped or didn't help in moving the issue forward. So I'm going to briefly get into this because some of the other more in-depth pieces that are coming up in this series will get into this more. But I want to mention, as I briefly did before, the importance of evidence in the process and the importance of a transparent use of evidence in the process. And I want to highlight here how at each stage of the HIA process, at each of the 6 stages, there's opportunities to use evidence. So when you're screening, you're using evidence of all types, as we discussed, to establish the health relevance of the policy or the program. Then in the scoping, you're using evidence to identify the key health issues. You're coming up with exclusion criteria because perhaps you can't cover everything. And you're really taking in public concerns at that point as well. So assessment, this is where people traditionally think about the use of the evidence, but it is at each stage, which is why I like to highlight this. So in the assessment stage, you're establishing baseline, you're establishing your predictions, significance, mitigation, and you're really reviewing all the types of evidence that you have. In the recommendation stage, you're using evidence to communicate findings and to make suggestions, as I said before, that are based on evidence, and we're transparent about what evidence we're using. And then the evaluation and monitoring stage, we're actually producing further evidence. And this is not only useful, as we said, about understanding, did the HIA work as we expected? Did different things happen? This can also help with future HIAs. Other people who are conducting HIAs can go back and say, hey, this line of reasoning really panned out, or look, when X happened, Y then happened, and that can be incorporated into future use of HIA. So I want to transition now to a specific case study of an HIA in Massachusetts, but before I do that, I want to highlight HIAs that have been done in New England. So in Maine, we had a paid sick days HIA done that was really looking at legislation on paid sick days and what was the health impact of that kind of legislation. In Massachusetts, we've had 2 child health impact assessments, which I've been part of, and they focused on the Massachusetts Rental Voucher Program, which is Massachusetts' version of Section 8. And so we will get into a further case study of that. And we also looked at LIHEAP, the Low Income Housing Energy and Assistance Program. There was also a bit of paid sick days work done, which part of a larger HIA, but they had some Massachusetts-specific information. There's some legislative language in the Massachusetts Department of Transportation, which talks about the need for and the requirement of health impact assessment, which I know we're going to be talking about more at the conference. And then also more at the conference, there's the Massachusetts Department of Public Health looking at the biomass plant. So they're doing an HIA of that work. And then in New Hampshire, we have a very interesting HIA that looked at the state budget. So what was the health impact of the state budget? So we have some really nice examples just from this region, and obviously you saw from the map, we have HIAs across the country to look at. So this is just some information that, that has appeared, and you can search and find on the mass.gov site about the health impact assessment in transportation work. And then this is just an example of funding. This funding opportunity has passed, but there have been more and more funding opportunities for us to get some help and support, financial support, in going out to do these HIAs. And then this is just a list to understand the different types of HIAs that have been done. We've had housing redevelopment, highway bridge replacement, local area and comprehensive plans, after-school programs, low-income home energy subsidies, oil and gas leasing policies. So we've had health impact assessments across the country work on all these different issues. And these have had impact on subsequent decisions. So we've had documentable impact from a lot of these HIAs. So planning improvements to increase pedestrian safety, for example, was one result of an HIA. A change in redevelopment plans that then, after the HIA, provided one-to-one housing replacement for affected families, which wouldn't have happened prior. We've had things like noise mitigation measures be required, living wage ordinances adopted, urban road corridor plans improved. So these are just a handful of examples of where HIA has really changed the discourse and changed what kinds of policies and programs were implemented. So, you know, another piece of HIA, if perhaps there isn't something that, you know, correlated that you can see, is that most HIAs raise awareness of health issues for some audiences. So another thing that HIA does is really get that health issue out there for people who perhaps weren't thinking about how health was related to the issue at hand. So now we're going to go through an example in Massachusetts of an HIA that was done in 2006. It was published in 2006, but it looked at the revisiting by the state legislature of the Massachusetts rental voucher program in 2005. So there was a proposal pending that really did a couple things. So there was a House proposal, a Senate proposal, and a governor's proposal. And so what the HIA was really examining was what would be the health impact of these different proposals, right? How do we help policymakers think about which proposal, which components of the proposal? So this is just a little background on the Massachusetts rental voucher program. And we decided as a group, when we were really thinking about how to do this, again, this was 6-7 years ago now, so very few HIAs had been done in the country. So another impetus for doing this work was to show HIA as an example, right? How does it work? What could it look like? What could be the benefit? So we decided in our scoping, we decided to really sort of couch our HIA to look at child health impact. So that helped us narrow down our focus. And so we really wanted to, so we called it a CHIA, a Child Health Impact Assessment, looking at the affordable housing, the MRVP, and child health in Massachusetts. So our guiding questions here were, what is the impact of the Massachusetts rental voucher program on child health? And then more specifically, what would be the impact on child health of these different proposals I described? So there was a governor, a state, and a Senate, and a House budget proposal. Excuse me, so our CHIA included several parts. We had an executive summary, which I'll show you, that had highlighted a chart of potential impact. So this executive summary would be that, you know, ours was 4 pages, probably now they recommend a little bit shorter, but that you would, you know, as you're going around, if it's in DC on the Hill, if it was in Massachusetts, it would be on Beacon Hill, et cetera, that you could go around, you know, give your few-minute pitch and hand something that really breaks down what the impacts were based on the evidence that you use. Now, we also included an introduction to HIA, because as I said, this was a while ago, and there was a lot less familiarity with what HIA is. You probably don't need a whole introduction anymore, but probably somewhere it's important to define it for people who haven't heard about it. In this first section, we looked at what the influence of housing on child health was. In the second section, we got more specific, and we really looked at the relationship between the rental voucher program and affordable housing in Massachusetts. Section 3 is where we really got into the impact and the implications of the current and the proposed components for child health and well-being. And then in Section 4, we summarized. And we had some appendices, again, a description of HIA because this was new for people, some comparison charts. We did a survey of our own of local housing authorities, so we included the methods for the survey as well. So each step we went through just as I've been describing. So for the first step, the screening, we really said, is HIA best? And we decided it was an appropriate way to examine the proposal. And then our scoping, we said, how do we do health impact assessment in this context? And we talked a lot about that's where we really narrowed down to child health impact assessment. And this is where we really decided, what could we cover and what could we not cover. So in the third step, which sometimes we call appraisal, I'm throwing that in. So if somebody says to you, step 3 is appraisal, and you haven't heard it before, now you have. Because it's assessment, appraisal, risk assessment. It's all ways of figuring out what information is out there and what information we can use. That gives us evidence for what the impacts on health and equity are of whatever it is you're looking at. So we looked at a lot of the research on neighborhoods and housing and how they directly and indirectly impact health outcomes. So things like exposure to environmental toxins, neighborhood institutions, stresses in the physical and social environment, neighborhood-based networks and norms, differential social infrastructures that may cover sanitation or education, racial residential segregations. We looked at all of these issues in the literature. We decided in the scoping section that modeling, for example, some of the economic impacts was out of the scope of our HIA because that information wasn't available at the time, and now some of that information is available. So I say that to remind us that HIA is very context specific, and it's very much about the information that's available and being clear about what that information is and what it's not. And if you have time and the ability to create new information because you want to answer a question that you can't seem to find data on, absolutely within the scope of HIA, but not required. So in the fourth stage, we developed recommendations, as one would do, and this is really based on the steps prior. So we looked at the rental assistance program that was funded and administered by the state, and we really looked at what the different issues were from the governor's to the House to the Senate proposal. And then in the reporting stage, we went to the State House. We went to different legislatures' offices. We worked with a children's advocacy organization to get this information out and announce it, to create a press conference. There were articles about it that came out in the paper. So there was a lot of different mechanisms of reporting, as well as reaching out to our stakeholders who we had been working with across the process. Now you'll see that the sixth step is missing from here, which was very common in the quote-unquote early days of HIA in the States, and we're really trying to push that this sixth step does get incorporated. It is a piece of HIA. It is an important step, which is that monitoring and evaluation, really trying to understand what happened afterward. And we did some of that sort of not consistently, I would say, gathering, where articles have been published, talking to legislators about the HIA and about the information. And so this bill was funded again, and so whether that was directly related to the HIA or not would be very hard to say without doing that monitoring and evaluation stage. But anecdotally, we have a lot of information from both advocacy organizations and legislators who used the HIA, who talked about it with colleagues, who made it part of the process. And the interesting thing about doing something like the rental voucher program or LIHEAP is that these are policies that come up each year, right? So this is something that you could expand on your HIA or go back to the HIA for. Now that's not always the case. For example, in LA when they did a health impact assessment of the I-710 corridor, that's a one-time thing, unless they revisit it or change or something. But often it's a project or program or policy that's a one-time thing, but it doesn't have to be. So these just get into the very specific differences between the proposals. And then this is just a slide to emphasize the different kinds of evidence that we use before I show you the specific results and the chart that we made. So as I said, we did this extensive literature review. We really looked for each proposal change, the direction of effect, the extent of impact, and the effect of the proposal decision, what we thought the effect would be based on the information we had. And we were very upfront about it being unclear if we didn't know. We really looked at the structure of the rental voucher program. We consulted with a really wide group of stakeholders. We did some primary data collection and analysis, which was just something we decided to do based on our time and the questions we were trying to answer. We made comparison tables. We did a cost-effective analysis. But we really said in our scoping that a detailed modeling of trends was beyond what we could accomplish with this HIA. So what did we do? We exposed these pathways that I talked about reviewing in our scoping and assessment stage. So we really looked at how air quality, mental health, noise pollution, traffic safety was related to housing and health. And we really did this step-by-step analysis that I was talking about and really tried to emphasize what we thought the likely implications of proposal changes were. So this is what our section of our executive summary looked like that showed the recommendations and impacts. And I'll just go through one line for the sake of time. So we had our program component because, as I said, there were those three, the governor, the Senate, and the House, and they each had different components. So we really wanted to go through and be clear about what the evidence said or didn't say about each component. So here we had information about time limits. So they were looking to impose time limits on the rental voucher assistance. So some said we're going to do a 36-month limit on continuous use of benefits. Some said a 60-month limit on lifetime use of benefits, etc. So then we really looked at the direction. We said that the literature is telling us and the research we've done is telling us this is negative for families who are not going to be enrolled anymore. The extent is very significant. And the proposal will create difficulty in finding safe and affordable housing. And we know that when that money is spent elsewhere, that we're not having money to spend on health things like food, safe heating, health clinic visits, etc. And so that is really a result of the proportion of income being spent on rent, so we don't have it to spend other places. So our evidence review showed us that the impact would be that there would be an increase in food insecurity for those who reach the limit by 50%, and there would be an increase in environmental exposures to known hazards. So if we're having less money to spend on housing, that usually translates to housing that isn't as safe, etc. And so we went through and did this for each step of the proposal. So let's, in our last few minutes here, get into how HIA can be used and then look at some of the benefits and challenges. So when we've done an HIA, we really want to get it out there. That's the sort of #1 point, is to communicate these findings and these recommendations. And that can be done through gray literature, publishing a white paper on an organization's page, or maybe a little brief, or maybe saying, here, post the whole health impact assessment. Let's really try to disseminate the executive summary, right, and a link back to the whole health impact assessment. There have been some peer-reviewed papers that have been written to emphasize the process and the challenges and the benefits of doing HIA, but not that many. We can really get it out into the political process. It can be part of hearings. So if we go to testify at a hearing and we have something like an HIA that really shows something perhaps a bit more than a statement about someone's experience. Although, as I said, the experiences and the interviews and the surveys are all included as important pieces of the document. But if you have this whole document with you when you're testifying at a hearing, it's often very different. So a recent example from Massachusetts is the Metropolitan Area Planning Council did a health impact assessment on transportation and the new MBTA fare hikes that are happening. And so they went to a hearing with a health impact assessment, which got a lot more press than them just showing up at the hearing as MAPC. And then you can, of course, as I said, hold your own press conferences, which we did as well. And you can be strategic about that, like we are for other things, right? You hold it at the State House, or you hold it at the children's organization, or what have you. So, and this is just another sort of longer brainstorm, and I'm sure if we were in a room together, we'd also think of other things. But you can use it to support funding. If you were wanting to propose doing an HIA as part of the work, advocacy, really helping to make the case to decision makers. We can really help talk about costs and benefits of issues when we have something like an HIA. We can think about using it in a regulatory versus a mandatory sense. So, mandatory versus not mandatory sense. So is it regulated? In some countries, HIA is regulated. It is something you have to do prior to proposing a policy or proposing a project. Now, we have something like this in the United States. It's called environmental impact assessment, and we just didn't have time in a 101 to get into the details of that. But often in the U.S., though it doesn't have to be like this, but often as it's played out, environmental impact assessment is something that has become sort of like, just another thing you have to do, and it really looks at environmental health issues. Very important, But a health impact assessment is looking at health issues in that very broad way that we talked about at the beginning through a social determinants of health lens, which environmental health would be a piece of. So there's a lot of discussion about, well, can we expand EIA? Can we expand that being mandatory? There's also a NEPA process, so how does that all work? HIA can also be used as a community participation tool, as we talked about all the different stakeholders at the table, so there's a lot of different sort of avenues and uses of HIA. So let's talk a little bit about why use it. So we know how we can, but why would we use it? And this is a quote that I really like from a prominent HIA researcher who talks about why we would use HIA. And the statement is that HIA is a means to find balance between evidence-based solutions and politics and the need to negotiate among competing interests to find acceptable solutions. So they say that some HIAs require only research-derived evidence, that's been through peer review or publication, and others require a much heavier emphasis on evidence gathered directly from affected populations or stakeholders, evidence that is derived from experience and from thought. So the HIA process makes the decision about which evidence to use transparent and negotiable. So it puts everything on the table and asks us to be responsible in the presentation of information and in the presentation of our recommendations and our decisions. So it also allows us to focus on these very complex interventions and policies and their diverse effects on social determinants of health. I think often, I know I do, get overwhelmed by the information and the possibility of interactions and how this all works. And HIA provides us with a very stepped process for going through this and making decisions about how do we use the information out there, with whom do we use it, to whom do we get it to. It allows us to include multiple research questions, which I think is very exciting and very important. It allows us to look at these multiple pathways from a quote-unquote non-health that impacts health perspective, so really getting in this social determinants of health perspective and really understanding all the various ways in which health may be related. And it really allows this diversity of evidence. Few methods have I seen where evidence of all types is valued and important and part of the process. Again, being that there is that responsibility to be clear about which types of evidence inform which kinds of decisions, but that everything is at the table. You don't have some, certain evidence reviews, everything has to be a randomized control trial. And if you think about public health and urban planning, it is very hard to do a randomized control trial with some of these issues. So it brings all that evidence to the table. So as we mentioned again, but again is a piece that I think is really important, so it bears repeating, that in this process of deciding which pathways are important and which evidence we're going to review and what types of things we're going to do or not do in an HIA, we're really involving this broad range of stakeholders. We can use it under various time frames, right? You can do it in a week, you can do it in 6 months. That is very negotiable and possible, and it really directs this open, transparent inquiry. There are challenges, though, of course. We would be silly to say there weren't. And in 101, we're going to have one slide on challenges, but certainly in a more in-depth discussion, we would have a larger discourse about this. But sometimes the challenge is time. So yes, you can do an HIA in a week, but whoa, maybe we can't include everything we want to include, or how do we get together everyone that quickly? Which also suggests that this involvement of stakeholders and cross-sectoral connections are important to be having and maintaining, such that when something comes up and it comes up quickly, that we're in a position to contact the people we already know and use those partnerships we've created. So it's also difficult based on the data that's available, right? We don't always have the data that we want, but that shouldn't be a barrier to moving forward and doing this kind of work. As I always talk about with friends who either work in the legislature or who do more on-the-ground policy work, the decision's going to be made anyway. They're going to take a vote and they're going to make a decision. So why not have something that's a very clear, transparent method that's providing a concise review and sort of discourse on the information that we do have that's related to that decision. We have all kinds of issues related to the diversity of evidence and the data, the expertise that may be around the table, the finances to do this, who and what is defining health or health outcomes, what are the underlying assumptions that are influencing the results or influencing presentations of results, and getting stakeholder input across all levels. So nothing I have said is to suggest that this is easy, but all that there are problems that we can overcome and work with and shouldn't sort of stop us from moving through on using these kinds of methods that are available. So some of the benefits. You slog through the challenges, you do this in a timely manner to get it out there. Why? Right? One, located within real policy and practice. HIAs are not a theoretical exercise. These are all things that are happening. These are projects and policies and programs that are on the table, and we have an opportunity to really get the information out there to affect these decisions. Again, it uses evidence from all sectors and all stakeholder interests, and it's open to the participation of anyone who has a stake. So this is it's an evidence-based process that's open. So another is public transparency. So you're getting out this information to a broad public and allowing people to participate and bring to bear. It offers us opportunities to work upstream, right? It offers us opportunities to do prevention and to think about what can change such that a health outcome that's a negative one doesn't happen, not just what do we do once a negative health outcome has happened. It provides us an opportunity to understand, and it provides us methods to elicit relationships between these complex problems, and it really contributes to public policy that's creating social, economic, environmental conditions that are healthy ones for everyone. So I'm going to provide a couple quick resources here, and then in a follow-up email, we'll have a sheet that provides some links where you can get more information about everything that I've discussed. So one is this new piece that's out by the National Research Council called Improving Health in the United States, the Role of Health Impact Assessment. And this is our first national document. We have documents from the California Department of Public Health that are really great. There's a new society of health impact practitioners in North America that has put something out. But this is one of the first, from our National Academies of Science and the Institute of Medicine talking about what is health impact assessment. And I mentioned this conference last week. I think it bears repeating because this was the save the date, but it was our first national conference on what is health impact assessment, how can we do it and how can we move forward. And now I'm going to turn it back over to Health Resources in Action, who's going to give you more information about how you can learn more through their series. And then we'll throw up a slide that has my email on it. I'm happy to continue this conversation. And again, you will get that sheet that provides further resources. So I hope that this has been useful, and I'm excited to hear about what you'll be doing and what your interests are and where your questions lie. Thank you.
Dr. Lindsay Rosenfeld, that was one of the best and most concise presentations in 1 hour on health impact assessments that I have ever heard, and I want to thank you for doing an excellent job presenting. I want to let people know a number of questions have come in. We're continuing to take those questions. Just type them into the question box that you'll see that appears on your screen, and we will do our best to answer as many as we can. Also, we will be sending out after this presentation to everyone who has registered a link to being able to get the recording and the presentation, because I know that there is a lot of interest out there in getting this presentation. And finally, I would like to say that, and I mentioned this in the beginning, but for those of you who joined late, that Health Resources in Action has been fortunate to get a CDC conference grant that is called the Promise and Practice of Health Impact Assessments, a New England conference open to our New England colleagues who are interested in learning more about the practical aspects of implementing health impact assessments. So what you heard today was just a taste of what HIAs is all about. We'd love to join with our New England network of health and non-health practitioners to learn together more about how the practical implications, opportunities, and challenges involved in health impact assessments. As I mentioned, we do have an application process for registering because we want to have a sampling of people across the 6 New England states. And the registration will be closed on April 24th, which is just next week. You see on your screen the link to being able to register. I encourage you to do so. It will be on a first-come, first-served basis based on representation across the New England states. And that link is tinyurl.com/HIA series. We have gotten a number of questions in. We will take as many as we can. But I would like to ask Dr. Rosenfeld a question that I think is relevant to many of the people who are participating today, since they are from across New England states. And as we know, New England is very varied geographically. We have both urban and rural populations, and I can tell that we have a lot of representatives from New Hampshire, Vermont, and Maine, and I'm sure my colleagues are asking this question. We've covered a lot about how this might apply to the urban environment, but do you see opportunities in the rural environment of applying HIAs as well, and what do you see as those opportunities and challenges?
Absolutely, great question. And as I noted, the sort of focus today on planning and development was not meant to be urban planning alone, but again, we had a very short time, so our examples perhaps were not as wide breadth as we certainly think about things in HIA. I think that the potential, not only potential, but the examples that we have of HIA across urban and rural, that the challenges certainly are different as public health and planning and other challenges and transportation challenges might be in a rural environment, but the benefits are largely the same, in that there is every opportunity to do HIA in a rural environment. I don't think that there's any, I can't sort of off the top of my head think of any reason, and certainly the ones that we've done, or not we, but that have been done across the country show that they're just as important in HIA, in rural environments. And where some of the difference in figuring out what to focus on or where those differences would be are really in those first two stages, in that screening and scoping stage. And that's where you're really going to dig into, okay, what is the particular issue here? What is the context here? And so HIA really allows that in its process.
Awesome. Again, this is Lori Stillman, Chief Strategy Officer at Health Resources in Action. If I noticed that some folks have some questions about the series and whether they can bring materials and posters to our May 31st conference at Clark University in Worcester, I would ask that you please send me or Allison Sherb your questions concerning the conference. My email is lstillman, L-S-T-I-L-L-M-A-N, @hria.org, and Allison Sherb's email appears on your screen. The first question I'd like to ask from the audience is from a woman, I believe, in New Hampshire. I've had little success doing a review of literature and finding documentation of how the non-traditional factors impact health. Are there existing studies that really can be used as evidence to project impact?
Yes, there absolutely are. So this is not to sidestep the question. However, the resource sheet that I'm going to be sending out is going to provide a lot of links to things like health and all policies, social determinants of health, and health impact assessment, where there are also a lot of great resources at those sites on such databases and articles. So that we have not perfect information, because we never will, but we have a lot of information on the social determinants of health and how traditionally, quote-unquote, non-health policies, programs, and issues impact health across a wide range of illness and disease outcomes, and also across a wide range of determinants. So I urge you to check out that list that I'm going to send out, and also I'm going to just flip the slide, and there's my email. I encourage you to email me, and I can point you more directly. There are URLs and things like that that are sort of cumbersome to state, but there absolutely is. Now, the caveat being that we can't always say, if it's a specific context that we're looking in, a specific policy and project, often that policy or project has not been done in that place at that time. That's why it's up for either vote or implementation. So there is that caveat that we're not going to have exactly aligned, but we certainly have a lot of information that talk about the relationship between social determinants of health and health impact that I think could be that could be useful in doing whichever work you're talking about or in an HIA specifically.
Thank you. Next question. I'd like to know an example where the screening process would suggest that an HIA would not be useful.
That's a great question. Often that has to do with time and context and issue. So I'm not sure that I could think of one off the top of my head, in the sense that if we sat across the table from each other, you may think of reasons in that space and place and time and context where we couldn't go forward, and if it was perhaps a different space, place, time, and context, we could go forward. So some of the things that would make it not useful to go through with an HIA would be to say, maybe the issue we're looking at really has, we can't, there's no data. Nobody can make any kind of statement whatsoever, which is often far-fetched, but it could be possible that there's a certain issue that comes up that we just really haven't explored yet, and maybe perhaps given the time constraints, which would be maybe another issue or another reason you wouldn't move forward with an HIA, you're saying, you know, this, we just heard about this project, it's about to be implemented, we have 3 weeks till it's voted on or what have you, and there really is an issue that we have very few resources on. So perhaps at that stage you're going to say, you know what, maybe we need to advocate or work with people to get some information on this issue so we're sort of ready next time, or we could work with this organization to see, well, what does the project or policy or program end up impacting as far as health is concerned. So it's more of those kinds of issues in the screening process. Do we have enough time to do what we want to do, or do we have the data?
To that point, at Health Resources in Action, we did do a screening recently that we decided not to move forward on. It had to do with a building that was being proposed in a very compact neighborhood in Boston, and the community had asked us to look at the health impacts of that process. The decision maker would have been a city agency as to whether or not it would go forward, and it turned out that decision was going to be happening within a couple of weeks, and we didn't feel that we could do a good enough job to really impact that decision, and so we decided not to go forward. But
thank you. That's a great example. So in that example, it really has to do with those issues that you deal with at screening. What's the time frame like? What's the information we have? You know, if we had 6 months, perhaps we could start to answer those questions that we can't find data for right now, or we don't know the answer to.
This question comes up a lot. What sort of budget is needed to perform an HIA for a municipality, for instance? And where are resources typically found to help with the conduct of HIA? And Dr. Rosenfeld, when you answer that, maybe you could talk a little bit about the difference between a comprehensive health impact assessment and a rapid impact assessment, which would be done with much less resources.
Sure. So either as expected or maybe frustrating. There isn't a dollar amount I can give you. I can't say it costs $20,000 or $3,000 or $300 to do an HIA, because that is very dependent on who's going to conduct it. Sometimes HIA happens because administration or, you know, the leaders of an organization say this is important, and therefore we're going to ask that this employee devote 10% time to it, right? So it's sort of an in-kind thing. Or perhaps you as an organization say, we don't have the person, time, or resources, we're going to hire someone to do it, and that would depend on their hourly. That would depend on, we've seen very often, maybe there's a university in the area who's studying this, and part of the work as graduate students are to do an HIA. So that's an example of where you could get some outside resources to do it, and we've started to see more and more that there are grants that we can apply for. So either through the Health Impact Project or through CDC or others, there's some outside funding. So I wish there was a straightforward answer, but on the other hand, it's kind of great that there's not, because it's not that you have to raise $30,000 to do this. You could certainly take a little bit of time from different employees. You could get some graduate students. You could hire a consultant. You could apply for a grant. So that also is very related to the second piece of Lori's question, which is about a rapid versus a comprehensive HIA. So if you determine that something is coming up in the legislature in a couple weeks and you want to do a rapid HIA, which really means is about the time. So we have a week to spend on this HIA before, both because our staff time, right, we don't have that much staff time to devote to it, and because the project or policy is coming up in a couple weeks and we need to get this information collected, produced into a, you know, a one-pager and get it out there. That's going to take obviously very different resources than a comprehensive HIA, which is, for the example I gave of the Massachusetts rental voucher program, was more a 6 month to a year process, depending on when you sort of talk about the beginning and end of it. But that really involved everyone on that project was volunteer. except for the coordinator, who was through what is now the Medical Legal Partnership. It was at that time the Family Advocacy Program at the Boston Medical Center. So you really just got a bunch of professionals from different sectors who were interested in this topic and were devoting some time to it. But obviously, since it was a longer period of time, you needed more resources over time, just for the person time of people to do that. And also, you know, what you can cover is different. So that is, again, in that screening and scoping stage, you're really making a decision, like HRIA said, you know what, we can't cover this in a week. Others may say, oh, actually, the data is available. We are going to do the best we can in a week. Be very clear that we had 1 week to do this, and this is what, you know, we were able to produce, versus something that's 6 months to a year, where you can get much more into the data. You can perhaps do some of your own primary data collection, like we did in the health impact assessment I discussed. We did a survey of local housing authorities personnel, and so we were able to collect that information and process that information, which had not existed before. Also doing a lot of qualitative interviews with stakeholders. So, you know, there's different things that are possible depending on the amount of time you have. And as I keep sort of hearkening back to, it's all about being transparent and upfront about what kinds of information you have access to, how much time you had to do it, etc.
I know that it's not a scientific process, but I did just return from the National HIA conference, and this question had come up over and over again. Mm-hmm. I had heard that around a comprehensive HIA, which would take a good year to do in many cases, that if you budget approximately a half full-time equivalent person, that you would probably, including all of the expenses and overhead, et cetera, it would be somewhere between $100,000 and $125,000 for a really comprehensive HIA, whereas the more rapid HIAs, which could take with a few months in length, could be somewhere in the $20,000, $30,000 range. Mm-hmm. Again, it's not comprehensive, but that's some of the information I picked up from the national conference.
That's great to have. See, that's why it's so nice to have a national conference and everyone sort of comes together and you pool the hours and the money that people have spent. It's great. That's great information.
At what point can the HIA fit into a transportation planning process as far as timing? Can HIA and transportation planning studies be done concurrently? And also, on a related note, has any training been done for the people or the group who will be doing the HIA for the Massachusetts Department of Transportation around the McGrath Highway Project too? I might be able to take on number 2 if you can't do that.
Okay, good. I have a little bit of information about number 2, but not details, so I may just toss it your way. I think, again, we come back to context, right? So could an HIE be done concurrently with the transportation planning process? Yes. I think that it's a great piece to add on. Now, if there's a specific context where we would think about, oh, would the HIA be more important a little, you know, maybe a couple months earlier to start, such that that kind of information that comes from a scoping and an assessment process could be entered into the transportation planning process, and then you sort of move forward on what the recommendations would be combined, so that you can almost see the transportation planning process as a piece of the HIA, because you're involving, you know, transportation planning already does a fantastic job of engaging community and having hearings and having workshops and all these kinds of things that you would love to include in an HIA on a transportation issue, but perhaps don't have the resources until you hook up with that stakeholder or that sector. And I mean, it's really a great example of you know, how you can use resources wisely and work with stakeholders. So absolutely. Now the second one, the people at the Mass Department of Transportation, combined with people at the Department of Public Health, have received a health impact project grant, but I believe I don't think it's for the McGrath Highway one, but I know that there's training going on.
Yeah, I thought it was for the McGrath
Highway.
Might be. But feel free to contact folks at the Massachusetts Department of Public Health who are doing a lot around health impact assessments, and we'll be doing trainings around the region in the future. And actually, we will be a subcontractor on one of those.
Right, and they'll be at the conference.
That's exactly right. Can you define how you're using the word evidence here, Dr. Rosenfeld?
Sure. I'm not entirely sure where in the presentation that came up, so I will just sort of assume it came up in our discussion of the assessment step when we were talking about evidence. So this is both exciting and tricky about HIA, and actually I'm working on a study/paper right now on exactly that issue of what is evidence in HIA and the use of evidence in HIA, because we don't have a lot codified in our guides and in our discussion about that. So what is sort of codified is that what evidence we use and how we use it needs to be transparent. That evidence can be anything across the spectrum, from qualitative to quantitative, from quote-unquote objective to subjective. And in valuing and being transparent about when we use evidence, exactly that, defining it. What is it that we've used? What are we considering as evidence? Where does it fall on that spectrum of quote-unquote objective or subjective, or qualitative versus quantitative? So again, it's all of these types of evidence are important and allowed and part of the process, but that we're very clear about sort of where they fall on that spectrum and maybe some of the benefits and limitations of using different types of evidence.
Thank you. Can you describe what the difference is when you say doing an impact evaluation versus an outcome evaluation?
Sure. So impact evaluation, I want to look at one thing to make sure that I'm talking about it the same way that I used in these slides. One second. All right, forget it. So outcome evaluation would really be after the fact. So we've performed the HIA and we want to know what effect the HIA had on the outcome that we thought it was going to affect, right? So if we suggest that diabetes incidence will go down because of something that was changed in the policy, the outcome evaluation is really going to allow us to see, did that happen or not? Whereas the impact evaluation is sort of as we're doing the process of the HIA or soon after, trying to understand what we think the impact will be and evaluating that. So it's more linked to that assessment stage, right? Whereas the process evaluation is sort of traditional process evaluation in the sense of we had a process that went A, B, and C, and therefore that we thought X would happen. You know, how close to the process did we stick? How is one element that we maybe see ended up being something we could evaluate in an outcome evaluation related to the process? So this is just different ways of sort of understanding the process we went through, what we thought the impacts would be, and then what the quote-unquote true outcomes were. Because if we only have this, what we think the impacts are going to be, and we don't have an evaluation that allows us to see what actually the outcome was, there's a disconnect there. Which I understand it's hard to do all of those things, but that's the thought behind the different types of evaluation in looking at HIA.
Great. Often advocates use environmental impact assessments mainly as a tool to delay and or kill a project that has already been proposed, but the group does not support. How can we make sure the HIAs are used more proactively to inform a project up front rather than primarily as a tool to discourage development projects?
It's a great question. And a lot of that relates back to this mandatory versus not mandatory. So since EIA, environmental impact, is mandatory, it doesn't have to play out like that, but often people feel that that is how it's played out. That's where the battle has become, about using it as a mechanism to delay, to divert, to not get people to sort of think creatively and in a cross-sector partnership way about how things can move forward. That's a lot of the reasons some people argue not to make health impact assessment mandatory, that we really bolster up the knowledge and ability of perhaps people who aren't planning the development to get on board and work together to look at what the health impacts are rather than make it something required of the, in this case, as you gave, developer who's proposing the new issue, whereas they're just seeing it as something they have to go through or that an organization can easily use to sort of stymie the process. Whereas if it's sort of located in the, what shall we say, sort of public milieu, for lack of a better word, it really could be a way to bring in different issues collaboratively rather than sort of one side. And truly, if everything isn't examined, and it sort of sounds like the example you're thinking of, doesn't sort of lay all the issues on the table, it's just taking a slice of it, then that's not quote-unquote true HIA either, because true HIA is really trying to look at the broad swath of impacts, whether they be negative or positive, or we don't know, trying to get that out.
Great. One more question. In the Massachusetts Rental Voucher Program, HIA, that you did, can you give us an example of the primary data collection you did?
Right. So one example of the primary data collection that we did was that survey of local housing authorities. So we put together that survey, we fielded it, we collected the information. That didn't exist before, so that was one piece. We also did some primary qualitative interviews with other stakeholders, other people involved in affordable housing, etc. So that's some examples of the primary data collection that we did.
Excellent. Well, our time is concluding. Again, I want to thank everybody who has joined this conference. There were 250 people who have, 275 people who registered. We will be sending a follow-up email to you about how to link to the recording that we have, as well as the PowerPoint that Dr. Rosenfeld provided here, and we'll have the information that you see on your slide right now concerning how you can apply to register to our Health Resources and Actions Health Impact Assessment Training Series, which I highly recommend folks go to that website as soon as possible, because we will be making final determinations of who can participate, and there are limited seats. I want to thank again Dr. Rosenfeld for an excellent job not only presenting but fielding questions on the fly. And we want to thank you all for participating and for your interest in promoting health, equity, and social justice in the New England region. And please visit our website at hria.org. Thank you.